Hello, good morning. This is Debbie Lynn Toomey, Tufts Medical Center's Injury Prevention Coordinator. You're watching Aging Strong under Health Links. This program is sponsored by the Quincy's Health Department. Today's topic is on over-the-counter drugs, and today we have a special guest. He is one of our, what I mean about our is at Tufts Medical Center's ER doctor. His name is Joshua Sheehan, and he'll be talking about over-the-counter medications. So, Joshua, welcome.
Thank you for having me.
Thank you. So, I know you have a presentation for us, but before you put the slides up, I want to ask you what got you into medicine, and specifically emergency room medicine?
Yeah, no, absolutely. To be honest, I didn't have too much exposure to medicine kind of growing up. Kind of went to college initially thinking I was going to be a mathematician because I grew up around here in Canton and was on the math team growing up, and that was kind of a lot of my kind of more academic interests. And then I needed to get a job in college, and I got a job in the hospital as a scribe in the emergency room. And kind of that was my first exposure, other than kind of TV, to kind of medicine. Fortunately, I was pretty healthy in my family growing up. And then I really loved it. Kind of got into like an anatomy lab as a class, kind of took some advanced biology classes. The next thing you know, I was applying to medical school. But I really didn't have as much of a kind of big background kind of in medicine. And I realized that it was a great opportunity to kind of help people. And I think my favorite, part of the job is actually just talking with people, getting to know people. I've kind of always been more of an interpersonal person, and wasn't sure if I was going to, find that in a lot of the kind of sciences. But I think medicine is kind of an art as well as a science, and it's kind of a really nice way to do that. And then kind of the emergency room, my personality is a little bit kind of more upbeat. I like to stay very busy, keep me on my feet. And I liked everything in medical school. I did my OB rotation. I liked it. I liked, surgery and doing stitches, and I even like my family medicine rotation. Honestly, emergency medicine was a good kind of blend of being able to do kind of everything, as well as provide a valuable service to the community.
Today, I'm really excited to have you talk about over-the-counter medications, because one of the things that I like to impress upon people is the fact that just because these medications that you buy in the pharmacy are readily available, you don't need any prescription, doesn't mean they are not harmless, because, we have to really think about what the side effects could be and how they can, interact with the medications that, some people could be taking, right?
No, absolutely. It's really important. And I think one thing to emphasize, even though they're available over the counter, there's always a pharmacist there actually for consultation. And they're not serving the purpose of, being your physician, but they can kind of help guide you and give you a lot of actually pretty valuable information about, hey, what medications are you on? They can look up your, list of medications, kind of, prescribed in their, in their system, say, oh, you really shouldn't, take that, because it could interact with, this medication, something that you would not really be able to know kind of on your own. And kind of some of the dosing is different depending on kind of your size and kind of even your age and kidney function. And again, all that is important to be aware of.
Yeah, thank you for bringing up that reminder that, a lot of pharmacies out there have pharmacists on duty or working, filling people's prescriptions. So please, get in line and ask them about questions. You don't have to have necessarily be picking up your own medication, but they're there as a consult for consultation.
Yeah, absolutely. I think actually one of my favorite exercises we did when I was in medical school is everyone got $50 from the school, and we had to go to CVS or Walgreens, and we had to basically come back with a concoction of things to treat these like hypothetical patients. And we're supposed to actually buy the medications and talk with the pharmacist. And again, we were early in medical school. I hadn't learned a lot, and it was really impressive. I didn't realize how good of a resource kind of the pharmacists there can be. And they're extremely knowledgeable, and they go to 4 years of school just for mastering kind of all of the over-the-counter and prescription medications. Is a really kind of valuable exercise. So I've spent a lot of times on the looking at the bottom floors of kind of all the CVS and Walgreens in different areas.
Yeah, definitely. Thank you for that reminder. So did you want to talk about over-the-counter medications?
Yeah, absolutely. Let me kind of pull up my slide here. So the first, and I think always a fairly common topic is kind of pain. You know, a lot of people have pain from all sorts of things, chronic conditions, even, you know, something simple of, you know, twisting an ankle, kind of getting a small cut. And everyone is always looking for, you know, some form of pain control. And I think almost everyone has heard of Tylenol and ibuprofen. However, what I find, and including in my own life, since being a doctor, I think the most common question I get from my wife is, should I take Tylenol or should I take ibuprofen for this? And the answer can be actually more nuanced than it might seem. And I wanted to kind of go over the actual differences between the two and to emphasize that they are different. And then I think the third medication that gets often thrown in there is aspirin as well. So first, Tylenol is acetaminophen. Tylenol is a name brand. Acetaminophen, the store brands are the exact same kind of medication. It's acetaminophen. And this is a medication that it works on a specific type of enzyme called those COX enzymes. And it actually works in the central nervous system to help treat your fever. So it's actually a really good fever medication. And that's why it's often used a lot of times in kids that have fevers to kind of reduce that. In itself, though, it also raises the pain threshold. And that is actually how it treats pain. It kind of works more in the central nervous system and on these kind of enzymes. So it works for just kind of pure pain control as well as fever. The one thing that it does not do is treat inflammation. So when you hit your arm and you have some swelling there, it will help the pain, but it will not treat the kind of the generalized inflammation. A lot of times you don't always need to treat the inflammation for something such as a bruise. It might heal, it might feel better in a couple of days if you do, but there are a lot of conditions where more like an overuse injury, when you have maybe a tendonitis or a hamstring strain or something kind of or a type of arthritis where there's a lot more inflammation. That is going to be better served with kind of an anti-inflammatory medication that can also work for pain control. Some of the issues with Tylenol is it can cause liver disease. And it doesn't necessarily cause liver disease in the correct doses, but in patients that have underlying liver disease, it might be something that needs to be avoided. It is not actually 100% needed to be avoided, but the dose needs to be reduced at a minimum. If you do have liver disease, I would discuss with your doctor, basically, if you're allowed to take Tylenol, and they might say that you have a limit of 2 grams per day, which is the common kind of limitation in someone with liver disease, rather than the general public, if you have no kind of underlying medical conditions, can take to around 4 grams of Tylenol per day. And again, those are the max doses. Tylenol actually, compared to ibuprofen, will have kind of fewer stomach problems. So sometimes a lot of people will, they're like, I have a bad stomach upset taking kind of, medications. Tylenol might be a better option if you're looking for just kind of pain control compared to ibuprofen. It is actually, though, one of the leading causes of kind of overdose in the United States. And because of that, though, it's really important to make sure you're keeping it out of reach of very young children. We'll kind of often, it's really important to know kind of how many Tylenol a kid might have, taken accidentally. Sometimes there's the chewable forms and different things that are more, lucrative, that a kid might actually take. But again, probably, less likely some of it is intentional too. And some of it is accidental. Someone just has a really bad headache that just won't go away. It is really important that you don't kind of do more than the recommended doses. I think there are some medications that it probably would be fine if you did more than the recommended dose. Again, I don't recommend that, but Tylenol is one of those that actually is really important to adhere to at a minimum the 4 grams per day, as it can lead up to toxic metabolites in your system. Mm-hmm. So then kind of switching to ibuprofen, which is basically a type of non-steroidal anti-inflammatory drug. So there's a lot of different kind of brands for all of these. For acetaminophen, it's really only Tylenol. For anti-inflammatories or NSAIDs, ibuprofen being the generic form. There's also Motrin, there's Advil, there's naproxen, and there's about probably 8 different types. Some of them can be prescribed, some of them are over the counter, but they're all the exact same type of base medication, where it's this non-steroidal anti-inflammatory, and they work fairly similarly. Some of them will last longer. It'll be basically, naproxen is kind of a more slower release and will last longer. You don't need to take it as often compared to a lot of the other ones are really just a different brand of ibuprofen, maybe in a liquid form, maybe in a gel form. One of those, being kind of Advil and Motrin. Again, they are the same equivalent as just taking the generic ibuprofen, just in a brand form. These work by blocking certain other types of enzymes from making prostaglandins. Prostaglandins is kind of a fancy word for one of these kind of enzymes in the body that end up contributing to pain, inflammation, and fever. So in this way, ibuprofen or NSAIDs can be used to treat fever, can treat pain. In addition to that, can treat inflammation. And that's one of the kind of important things for something that's more of an inflammatory process, some type of arthritis flare or tendonitis, or a sprained ankle. That is going to help with kind of that inflammation and kind of getting you back on your feet and sooner. However, one of the downsides of ibuprofen is it can be pretty harsh on your GI tract. People that have had ulcers cannot take ibuprofen. People that have gastric bypass should not take ibuprofen. And the last is people on blood thinners. And it's actually a really important thing that I kind of often see. A lot of people are well informed and know that already, but some don't. Or they say, I was told I can't take ibuprofen, but I didn't, necessarily realize that naproxen was this, the same thing. So anyone on blood thinners really should never take any type of anti-inflammatory, because one of the side effects of the anti-inflammatory medications is it very minimally, but it does works on thinning your blood. Kind of everyone knows about aspirin, I feel, and a lot of people think of that as something that thins your blood. Ibuprofen, isn't in the same degree of blood thinning, but it basically can have a degree of that. So we recommend avoiding it with blood thinners kind of altogether. The other kind of class of person that shouldn't take ibuprofen is someone with chronic kidney disease. And this is because compared to Tylenol, which is cleared by the liver, ibuprofen is cleared by the kidneys. And basically, if your kidney function is not great, one, it might not clear as well, but two, it can actually cause damage due to some of the kind of properties of the ibuprofen itself and the mechanism. It can cause further kind of kidney damage and can be recommended. If you have a question on kind of how bad your kidney kind of disease is, whether you need to avoid it, that's something that you'd have to talk directly kind of with your doctor. But if you don't have a kidney issue, you're not on blood thinners and you don't have any major GI issues, it's a really good medication that you can take. And I do recommend, because of the GI kind of component, because it can irritate kind of the stomach lining, is always taking it with food. And so the last one is aspirin, which I kind of view as basically a special type of steroidal anti-inflammatory. It does have kind of a lot of the same properties and works just very slightly differently to also thin the blood. This can be used primarily for pain. It can also be used for fever. And it also has the anti-inflammatory properties. And then on top of that, it has been proven kind of to help treat heart attacks and prevent stroke. It's important, though, that, if you're going to be taking aspirin on a daily basis for kind of your heart kind of overall health and kind of prevent stroke, that you're doing that in consultation with your doctor. there's a lot of reasons to, potentially not be on that in a daily life as well. Can be harsh again on the stomach. The blood thinning can be a risk if you're at risk for falls. But it's a kind of a risk benefit kind of ratio that a lot of your doctors will kind of recommend that you probably take it, or some might recommend that you don't because of a specific reason related to yourself. One thing that's really important if you have kids, grandkids, anything, is they should not take aspirin. Aspirin is associated with a syndrome called Reye syndrome in children. And really should never be used for kids. It's very rare if it were, but because of the kind of historical fact and that it is associated with that kind of syndrome, and that Tylenol and ibuprofen work just well for children, and there's no real extra benefit of aspirin because of children aren't at risk in general of heart attacks and strokes. It should always be avoided in kids. And actually, you should lock up or put it out of the reach of children for that purpose so that they don't get into it.
When I used to take care of a lot of older adults, especially pre-op, asking them about their listed medications, a lot of them, I shouldn't say a lot of them, but some people still associate aspirin with pain relief. And so instead of taking nonsteroidals or Tylenol, they would readily just go and take their aspirin, because that's one of the, more of the old-fashioned pain relief from when they were growing up. And since then, as you've mentioned, there's the nonsteroidal medications, and there's so many different options out there.
Absolutely. The other question I feel like I get a lot is, can I take them together, or should I just take one or the other? And the answer is actually you can take them together. They work differently. Tylenol and ibuprofen, they're being cleared by different organs. They're working kind of in a different mechanism. A lot of doctors will have you alternate between the two. And basically that is to kind of continue to get kind of relief from a slightly different mechanism. However, you can also take them at the same time. One of the things that I find often is that patients it's hard, and even myself, when I've tried to alternate it, to take a medication every 3 to 4 hours and then switching it can get really confusing. And sometimes it's easier to just have a set kind of panel and kind of plan, and depending on kind of how severe the pain is. Again, we always recommend using the lowest dose and the least number of medications for treating kind of anything. But something that's really severe pain, you can take both. And actually, there's a couple of studies in the hospital when people are blinded that when you're taking Tylenol and ibuprofen together, it actually usually works better for a lot of conditions for pain control than even taking something stronger like an opioid medication. And I think those studies are really kind of profound, because I think a lot of people will kind of come up with generalities of Tylenol doesn't work for me, ibuprofen does, or vice versa. And for some of those patients, if you take them together, you will get a lot of kind of pain relief, and it's important for that.
That's great.
The dosing in general. So Tylenol comes in two different general types. It comes in the regular 325 milligram tablets that you can take either one of, two of, or three. And the dose that you're taking depends on how often you're going to be taking it. If you're taking it up three of them, which comes to 975, you can only take that every 8 hours. However, if you take the lower dose, you can take that up to every 4 hours. It also comes in an extra strength, which kind of gets confusing because it's almost in between the other doses. So the extra strength Tylenols come as 500 milligrams. And so that is either you take one of those every 4 hours, or you take two of those every 8 hours. In general, I typically recommend taking the 500 every 4 hours. That way you can kind of see how your own pain is doing, and kind of get more, kind of relief at a lower dose that still works. Taking ibuprofen, these all pretty much come in the 200 milligram tablets. And so for ibuprofen, the typical dose is 400 milligrams to 600 milligrams. The pain control is not that much higher at the higher doses, but the anti-inflammatory effect can be a little bit more present. So depending on exactly what you're using it for, that might be a reason to use a lower or higher dose. And at doses above 600, I do not recommend using unless you're being specifically directed. It used to be they didn't really realize that there was this ceiling effect with ibuprofen that, adding kind of more, you would think you would just continue to get more anti-inflammatory and more pain relief. But that actually is not true. You hit your kind of limit around 600. So taking the extra doses of like 800 that some people might more historically have taken or prescribed really is not going to give you any benefit, and you're just kind of being, you're going to have the side effects more likely.
Quick question on the ibuprofen. Do people get used to a certain amount of dose after a while and that they require a little bit more?
That's a great question. And your body can get used to some of the medications. It also depends on your kind of body weight. A lot of these medications are actually weight-based. And interestingly, even though in the hospital for a lot of other medications, we calculate your weight and kind of do a medication directly on that. With over-the-counter medications, that's a little more complicated because not everyone knows their exact weight, and we're trying to more generalize it and make it safe. So I think more so than people getting kind of used to it, and that can happen with some medications, but Tylenol, ibuprofen is a little bit less kind of that. But maybe that their dose, they actually just need a higher dose kind of for their body. And it's not 100% based on weight. It can also be based on your kidney function and kind of how you metabolize medications. So if something like that changed, maybe your dose might change. But in general, you can still take these kind of, long term. And I would say it's not necessarily that the medication is not doing the same, kind of effect, but you might just get used to kind of, chronic pain if that's what you're kind of, treating. And kind of your condition might be developing or worsening, and it's just not getting as much relief rather than the medication, not working or being processed differently. Some other options for pain control are some topical medications. And a lot of these are available over the counter as well. And a lot of these can be kind of prescribed. And again, generally, the only difference between the over the counter and these and the prescribed is whether your insurance might cover it if it was prescribed. But the medications are more or less the same. I get that a lot, that people will come in that I was using the lidocaine patches over the counter, but I want the prescription strength. And some of them that you can get at slightly, like lidocaine 4%, you can maybe get 5%, but the actual benefit of that is going to be very minimum compared to what is actually being treated. The two kind of general brands of lidocaine patches are Lidoderm and Sonopass, which is listed here. And these are basically patches that block pain signals only locally to where they're applied. So this is good for if you have, pain in a localized kind of region. Can be for like neck strains and back pain. These are often really useful. It can actually work though for hit your arm and you have like kind of local pain in a bruise. It basically works at dampening kind of just the pain signals just in that area. Grant, this is not treating any of the underlying, condition. It's not decreasing inflammation. It's not going to bring a fever down. However, it's just for pain control and can be really helpful. And a lot of times it's most helpful when used kind of with, another type of medication. Taking Tylenol plus using the lidocaine patch can add a little bit of extra. It can also be helpful for like painful skin conditions like shingles. You can kind of put it topically kind of on the skin to just help with something that is, kind of burning and in pain. Similarly, you can use topical anti-inflammatory medications or NSAIDs. The most common one that I see used is Voltaren gel. And this basically reduces production of prostaglandins at that area and you basically rub it on. This can be really helpful for patients with kind of chronic arthritis of different joints, where it's something that you're going to be taking or using, every day or multiple times, but you don't want the systemic exposure to taking Tylenol or ibuprofen every day. This is something it can be absorbed into your system, but it's very minimally so. So the side effects of the anti-inflammatories, you're not going to be as exposed to that. The real downside, it can be some people can cause some irritant, and if you're using it too much, it can corrode the skin kind of at that area. So just be kind of careful of that. And but otherwise, actually, for kind of intermittent use is a really kind of good option for some people. There's another one that a lot of people I don't think know of, and this is capsaicin cream. This is kind of cool. It actually is made from basically the active ingredient is basically from what's in chili peppers. And it basically works. If you ever had chili peppers and you get kind of like a numb or kind of burn like feeling on your tongue, it works by basically deleting this one of these kind of substances that's a neurotransmitter involved in pain. It kind of helps prevent kind of basically that pain signal from being transmitted. Again, this only works kind of in a localized area. One of the best uses of this is kind of for more things like shingles, like I was just talking about, or a topical, kind of irritation or something else that's locally painful, but can be a really kind of good option for things like that. It actually can also be used for some chronic abdominal pain. It's really interesting. You basically rub it on your stomach, and basically the same way that like maybe you'll put a heat pack, like some people might put a heat pack on their stomach to give some comfort. It kind of works in a similar way to that. Think about you just basically kind of putting topical chili pepper powder on you, and it kind of almost like burns in a way that just can kind of soothe you. Again, it's not treating any of the underlying condition or factors. It's simply just as a kind of a relief for pain. Mm. And then I think one of the last things that people often use is kind of just a counter irritant. And this is BioFreeze or Tiger Balm. And these are kind of different types of medications that basically work locally on the skin to create a cooling or heating sensation that mostly kind of distracts from the pain, as well as it can increase some of the blood flow to the area that can kind of sometimes help with kind of healing, or for some patients that will kind of provide pain relief. Any questions on kind of that?
Well, I was just wondering, as far as what do you recommend for people who do have the chronic pain, especially during the cold season? They see the arthritic pain seems to be a little bit worse for some people. Would you recommend before they do any activities to take some medications, some of these medications before they start moving around so they can move around?
Yeah, so it can be really tough, and definitely the cold affects a lot of kind of the different types of kind of arthritis that can be really difficult. And it's all about kind of knowing your own body. Some people, if you do just get up, kind of move around, get some maybe heat kind of on your joints, sometimes we'll get some kind of improvement in doing some kind of minor stretching or kind of even exercise to get through kind of that initial morning stiffness aspect. And if it's just that, I'd recommend, doing more holistic things rather than kind of using medications. However, if it's something that's causing kind of a lot of pain and actually is making you walk with a limp, or making you, just kind of, irritated and in pain, then I think these are good options. And a lot of these can be used kind of on a more daily basis or kind of morning basis. Specifically, I think the Voltaren gel would be a kind of good use for someone with maybe, some knee arthritis in the morning when they wake up, or some chronic back pain, kind of applying the lidocaine patch.
And I love the idea of thinking of the capsaicin being a warming type application. And then you have the BioFreeze. Would you consider that more the cooling?
Yeah. And I think it kind of is definitely more of a cooling, and kind of I'd use the BioFreeze more for, kind of local joint issues, maybe a strain of some kind. And again, sometimes it does help. But a lot of times it's, just kind of a distracting, and it makes it feel nice. It's actually interesting, basically, how everyone rubs kind of a joint. So you bump your elbow on something. You always rub it. And there's actually a reason for that. And basically, you're activating a different type of receptor when you're touching kind of the area and rubbing it, that basically can distract from some of the kind of the pain receptors. And so that is actually, like, there's a mechanistic reason why that works. And I think some of these kind of medications like Biofreeze, and they kind of hold on to that kind of principle to help.
Yeah, I love it.
For something like, if you break your bone, it's not going to do anything, because that pain is too intense and more and deeper. But for kind of something that's more on the superficial aspect of the skin or the joint itself, it should help.
Yeah. And you brought up a good point. It's good for people to be aware of what helps them. If it's something, they might have arthritis, but maybe something cooling might be better for them than something warming. So, trying out different types of options is very important.
Yep, absolutely. All right. So I'm going to move on to heartburn, which is kind of another really common complaint that we see. So I think the one thing about heartburn is that a lot of patients also will kind of feel like they're having heartburn, and they're actually having kind of a heart attack. And it can be really hard for a patient, even for physicians and providers, to tell kind of the difference without getting an EKG. A lot of times, though, patients will have a history of this, and it'll be a good story that you ate something that was maybe a little bit more spicy or greasy. Maybe you had an alcoholic beverage. All things that kind of can increase acid production, or you just have a long-standing history of acid reflux and heartburn. But I always caution people, if you or someone that has never had heartburn before, to talk to a doctor if you're all of a sudden kind of getting heartburn, especially if it gets worse kind of with walking, or if you're short of breath with it, or anything else. A lot of times it should just be more of like a burning or discomfort kind of in the stomach. It can go kind of from your stomach kind of up to your chest, and that's where it can be kind of confused. But again, I always just caution that it's always better to get checked out first to make sure it's not anything related to your heart, especially if you have kind of risk factors for heart disease, smoking, high blood pressure, diabetes, things like that. But if it is basically heartburn, and you can always try the kind of the more immediate acting medications. One of the kind of oldies but goodies is Tums, and this is just calcium kind of carbonate, and basically it just neutralizes excess stomach acid. It works very quickly. A lot of people get pretty immediate kind of relief from that, and it's a really pretty well tolerated medication. Comes in all different. If you go to a store nowadays, you can get it in 10 different flavors and forms, and you can get mints and all sorts of things. But definitely is something that is kind of a go-to, and I do recommend because again, it's actually really pretty safe. Really, the only kind of side effects are the fact that you're kind of increasing calcium in your diet. The biggest kind of problem with that can be kidney stones. Again, 1 or 2 Tums, kind of a week is not what I'd be worried about. If someone who's using 4 to 6 tabs maybe a day, that is already predisposed to kind of kidney stones. It's something that can basically raise your calcium level in your urine, that can kind of lead to that. And the other thing is, if you have any conditions where you're already known to have high calcium levels in your body, sometimes can be in patients that have kind of cancer or some kind of other more rare kind of chronic conditions. If they have that, you should probably avoid calcium carbonate, because again, the active ingredient here is just calcium. Can cause a little bit of constipation. The only thing I recommend is usually because it can dehydrate. People get dehydrated kind of at the same time with the calcium, and it's just drinking it with fluid. Another medication is Pepcid, and this is famotidine. So the over-the-counter medications, Pepcid is the brand, but I think a lot of people, that's what they kind of know it as. But you can get, the CVS brand, Walgreens brand of famotidine. It's the exact same active ingredient. And this actually is an antihistamine medication. So it's kind of similar to other antihistamines like Zyrtec or Claritin, but specifically it kind of it works on this H2 histamine that reduces stomach acid production. So a lot of times this won't be as immediate of relief as like using calcium carbonate or Tums, but can basically provide a little bit more long-term relief in a couple of hours. Say you're about to eat a greasy meal, it might be something that, to take beforehand if that always kind of affects you, or take afterwards to give it a little bit more, kind of long-term kind of effect. It's a pretty safe medication. Really the only issues if you've had an allergy to some of the active ingredients, but often it's used for allergies, so it's very, that's pretty rare, and is, again, pretty well tolerated. The other medication is kind of Maalox or Mylanta, Rolaids, and these are basically all forms of kind of combination of medications that basically neutralize stomach acid, and they work really well. These kind of, again, work pretty immediately, so it's actually a really sometimes helpful tool in the hospital when it's pretty sure someone has heartburn, and we kind of give them kind of Maalox, and it pretty immediately either works or it doesn't, and it's usually can be helpful. If it's not helping, then maybe it is something else. Can also be used for kind of some chronic kind of GI upset. Some of the medication kind of in the component of the Maalox is kind of just soothing kind of on the stomach lining like that. And then I think one of the last medications is Protonix. And Protonix or Meprazole or Pantoprazole are the kind of the active ingredients and for these type of medications. And this is a proton pump inhibitor. So this doesn't work immediately in terms of neutralizing the stomach acid, but it reduces the production of stomach acid in the first place, and is used for kind of more severe kind of chronic acid conditions. People that have kind of chronic issues with their kind of esophagus, maybe something called Barrett's esophagus or gastritis. Basically, this can help decreasing that production to kind of prevent the problem. Some people with ulcers, this is kind of the medication that we typically would prescribe to basically help reduce that stomach acid from kind of eating into the lining anymore, and definitely is useful in kind of an adjunct with those other medications for kind of more long-term relief. A lot of times, though, it's just a short course. So someone basically maybe went on vacation or, ate something that didn't agree with you, and now you're kind of dealing with more acid reflux. Taking this for kind of a week to kind of get your levels kind of back to baseline might be all that you need. And if you're taking it on a very long-term basis, though, I would discuss that with a doctor. It can put you at risk of getting some different infections. Basically, part of that, the stomach acid is used for a reason, kind of in the stomach to prevent certain infections. You can be exposed or more at risk for C. diff, which is kind of a bad diarrheal infection, and even actually pneumonia. It's been linked to as well. So on the long term, this is something that to discuss with a doctor, but on a very short term, if you have kind of a history of it, can be a good medication of kind of getting your acid levels back to kind of baseline. And again, it's some people have a little bit of nausea or diarrhea with it. Otherwise, it's pretty well tolerated, but again, puts you at risk of C. diff, pneumonia. And actually, the last thing is that it can make you at increased risk of fractures. And again, this is because of part of you're decreasing the acid in the stomach and not getting absorption of certain nutrients. And I think, as we kind of mentioned, always, if you're concerned or this is new for you, would recommend seeing a doctor, as can be signs kind of a heart attack.
Some people might think, or ask a question regarding infection and gut health, the acidity in the stomach, how it's actually not a bad thing. We need a certain amount of acidity level in order for us to digest, right? To break down our food. Yep. So some people may not see that connection between, controlling the acid, taking these medications, and also infection. Can you just talk a little bit about that, the connection between the immune system and also our gut health?
Yeah, no, absolutely. So basically, kind of everyone's kind of gut will have their own kind of buildup of kind of bacteria and different kind of organisms that actually live in the intestine, and a lot of them serve a really important purpose to promote kind of your own, what we say, like gut health. Some of it is for the absorption of nutrients. Some of them are filtering out actually other bacteria that would be harmful and cause kind of more of an illness. And actually having them is like kind of like a guarding your own kind of intestines. But a lot of it is based on the pH and kind of what can live and kind of what environment. And it's kind of similar in kind of different conditions when you basically change that acid or that pH. Different bacteria might not be able to live there, and different bacteria might actually live there better. And some of those can be kind of more harmful and not protect you and your gut in the same kind of way. And so that's kind of what can happen with that.
Thank you. Very good. Thank you.
Yeah. All right. We'll talk about diarrhea as well a little bit. So I think a lot of times this is something that we see kind of a lot of it. It's a really uncomfortable, thing for patients. In general, diarrhea is not as dangerous as more of a discomfort, and it's mostly about staying hydrated and making sure that you're taking in electrolytes to balance kind of what you're getting rid of. So I think one mistake that we see some people do is basically you're having a lot of diarrhea and you're maybe drinking some fluids to kind of, to take up. But you actually need to drink something with, electrolytes in a balanced solution, because you lose more than just kind of the fluid kind of in your stool. Often people come in with a lot of kind of electrolyte issues when more like chronic diarrheal illness. In general, I prefer patients to, if they're only having a couple of bowel movements per day with, that are really loose, is really to just kind of, almost deal with it. Because we do have medications to treat it, and that's Imodium or loperamide. But it's one of those medications that does have some true side effects, and it's a lot of them is just kind of dose dependent. If you are, though, having significant, kind of movements, and I usually say more than 3 or 4, per day, and it's a lifestyle issue, or sometimes, you're going on a plane and you can't, be having kind of, diarrhea. This is a really good kind of medication for short-term use that basically can slow down kind of the transit. And what's helpful is the kind of the dosing of it is basically dependent on kind of how many bowel movements you're having. So basically you take kind of this first dose of 4 milligrams, and then basically every loose stool that you have after that in that day, you take another 2 milligrams. So you're kind of titrating your own kind of bowel movements, and it works actually pretty good. It basically slows down kind of the movement of the intestines. One of the side effects, though, is this is actually an opioid-like medication. It's not the same. It doesn't give you the pain relief because it works on it's a different kind of opioid receptor. But when you take a lot of it, or if you have kidney issues, or it builds up in your blood, it can actually have a very drowsy effect. It can make you dizzy. And the biggest thing is, if you take too much of it, you can get constipation. A lot of the times with diarrhea, is the way I like to explain it to patients, is your body is trying to get rid of something. Maybe it was the burrito that you ate or something that the body didn't agree with it, or the takeout. And your body is actually trying to, get rid of kind of everything in there so that you're actually, don't get even more sick. So, don't always, it's not always important to kind of, fight that. But again, it's kind of this balance of, how bad is it? We don't want you to get dehydrated. We don't want you to have, electrolyte kind of issues. But it's just, sometimes people take it for, just one loose stool in the day. And I probably would avoid it because of the side effects for that. But, when you do need it, it is a good and available medication. The other one is Pepto-Bismol, that I think a lot of people, are probably more familiar with. And this basically does a couple of things. It provides a protective coating kind of to the stomach and intestines, can really help a lot more with kind of the upset stomach, versus Imodium is really just kind of decreasing the transit kind of the stool and providing preventing you from having kind of the diarrhea. The Pepto-Bismol will actually kind of make your stomach and intestines feel a little bit better. It also basically has some antimicrobial properties to reduce the bacteria that cause diarrhea, and that's why it can kind of help. And that's often why it's used as a first sign of diarrhea on a like a traveler's diarrhea is basically start taking some Pepto, and it can maybe reduce kind of some of that bacteria that are causing the diarrhea and help you, and maybe not get as bad as it otherwise would have. One of the big side effects is that it can darken the stool. It's actually really important if you ever come into the hospital and you're for concern, a GI issue, to let somebody know if you are taking Pepto-Bismol, because it can basically mimic your bleeding in the stool and form kind of really dark stools, and is just kind of important for that. The other important thing is to know that it actually has an active ingredient of aspirin in it. Basically, it's a salicylate, and a lot of the side effects that you can get with aspirin, such as ringing in the ears and a couple of kind of other things, you can get with it. And most of that, though, is with overdose. So never take more than basically prescribed. But typically, I'd say it's more in our kind of college age kids that are away from home for the first time. They'll kind of take they're like, I went through 3 gallons of it because I was having a GI kind of issue that we see an issue. But every once in a while we see it with someone who's frustrated with the way that they're feeling. So again, it is something that you can overdose on. So don't take more than prescribed. And on the other end of the spectrum is basically constipation. And so constipation, I always want to kind of, warn people. I think I actually have on my next slide here is if you have any of these kind of red flags, you need to seek attention, because constipation, especially as we get older, can be or is more likely to be from something that's not just regular old constipation, and meaning it could be some type of obstruction, and that's something that is medically very different and treated different. If you're someone that your whole life has had constipation and that you're constipated, then that's a totally different story. For all of a sudden you're getting your first kind of bout of being really constipated. In particular, if you're not still able to pass any gas, that is a concerning kind of symptom. So a lot of patients, they'll be constipated and they can't get anything out, but they're still passing gas, and that's a relieving that there's not a full kind of obstruction there. Or if you're getting severe abdominal pain or even vomiting, that should not, it can be caused by constipation, but it definitely makes me suspicious that something more serious is going on. The people that are at most risk for this are patients that have ever had any type of abdominal surgery, and that includes women having C-sections. Also, if you have any known hernias, those are all risk factors for developing a bowel obstruction. And if those type of patients, are not, having bowel movements or not passing gas, you need to go see someone in your primary care or you're in an emergency room before just trying to treat it yourself. That being said, constipation is a very common thing, and there are very good medications that we can use kind of over the counter that help. One of the ones that I like the best is Miralax. This is basically what's called an osmotic laxative. So it draws water into your intestines to soften the stool. And it's basically actually a dose dependent medication. So basically the typical dose is 17 grams, where you just basically put a scoop of this into water and then you drink it. But you can basically titrate it to your bowel movements. So you can take a second dose if you're still not having a bowel movement, and you can do it on a more long-term basis. And it's a fairly safe medication. A different medication is bisacodyl or Senna, and this is a stimulant laxative. So what this is doing is very different than Miralax. It's contracting the intestines to help move stool through the bowels. And sometimes this can be really effective, but this has a lot more side effects, because this can actually cause a lot of pain and irritation because you're actually contracting the intestines, versus the Miralax is really just kind of drawing that water into the intestines. And the biggest thing is just to stay well hydrated while doing that. In addition, some of the more common things that you can do is just fiber supplementation. So a lot of times your body can figure this out if you kind of just readjust kind of what you're eating, eating foods, fruits, vegetables, whole grains, or taking a supplement, Metamucil or methylcellulose. Biggest things, staying hydrated. Sometimes it's also a medication side effect. So always consider that, did you start something recently? Do you need to talk to your doctor? And sometimes there are certain medications that I start, especially opioids. If you recently, had an injury or had something that you're on an opioid, that is notoriously for causing constipation. And I tell actually all my patients to start just taking some Miralax with it, just to prevent it, because it's that common of an issue. Getting to allergies and congestion. So in general, if you're having kind of seasonal allergies, not really the season right now, but some people still do, or kind of, get it from kind of animals and all sorts of things. Some of the best medications are antihistamine medications. I think everybody knows about Benadryl, and I think a lot of people, overuse Benadryl kind of for their allergies. Benadryl does work really well. It is an antihistamine. But the biggest thing that I want everyone to be aware of is that there are a new type of antihistamines, or second generations. And these last longer, have less side effects, and are less drowsy. So the one that I recommend, and again, I don't have any affiliations with any of these companies, but in general, Zyrtec or cetirizine tends to work really well, as well as Claritin or Loratadine. These are kind of slightly different formulations of antihistamines, but all basically work the same way. And it helps with basically the nasal congestion and kind of the allergic response in your body. It can also work for basically if you're having just kind of like an allergic skin rash. Basically, they can help with kind of the itchiness. And again, it's not as potent in terms of the short term as Benadryl. You have, a bad allergy and you take Benadryl, it probably will work a little faster. However, it's a lot safer to take some of these second generation antihistamines, and you can take them on a daily basis as well. Versus Benadryl actually is a fairly dirty medication. It can combine with a lot of other medications and have a lot of adverse effects, specifically causing drowsiness. It increases patients' risk of falls. It can make you have dry mouth. It can cause you to have some dizziness as well. And again, not saying that you can't use Benadryl, but I do caution folks, especially as they get older, as they have any issues with their kidneys, or if they're taking more than 2 or 3 medications prescribed, to really, consider whether you should be using Benadryl or not. The other for just kind of congestion or allergy kind of symptoms is just using kind of a nasal saline spray. A lot of these actually, they help moisturize and clear mucus from the nasal passages. And actually, some people don't love the way that it kind of feels when you do it. And I think that prevents its use the most, but actually can be really helpful and is actually good for kind of the more long-term kind of like nasal health and passage. You get a upper respiratory infection. So maybe it's the common cold. It could be COVID. It could be the flu too. A lot of them, though, cause very similar kind of symptoms. And there's nothing basically that you can do to treat the underlying cause except for COVID getting vaccinated, flu getting vaccinated. But once you kind of have the symptoms, a lot of it is really just kind of supportive medications to make you feel more comfortable. And what I would like to press on people is actually using more nasal sprays. These are more localized. A lot of times the issue, again, is just kind of really bad congestion. You get this thick mucus that's kind of all kind of in the nasal passage. And a lot of times it basically starts as kind of an upper infection, and then kind of it can slowly basically drain down and kind of get into your lungs. While it's still kind of up in your nasal passages and kind of more of a head cold kind of feeling, these medications called Afrin or oxymetalazone or phenylephrine that are nasal sprays are really helpful. And what they do is they're constricting the blood vessels in the nasal passages to reduce swelling and congestion. And basically that will allow you to breathe a lot better. And it actually will allow kind of whatever is in there to drain normally. And sometimes you might know that you'll have a little bit more of a runny nose kind of after using some of these medications, but that actually is a preferred, to this congestion. If you're getting it kind of out of, kind of your nose, it's not going to be going down into your chest as much, and you're not going to have any as much kind of discomfort and trouble, kind of breathing. I think a lot of patients, especially kind of when you go to sleep at night, you kind of lay down and then all that congestion can really kind of block part of your airway and really cause you to have a hard time breathing. But using some of these medications can really kind of help. The biggest problem with these, though, is that your body actually gets so used to them after 3 days, and that actually you can basically then have what's called rebound effect. So I don't recommend using for more than 3 days at a time, but hopefully for most patients, that will be, the crux of the kind of the illness, and they'll be starting to get better kind of after that time. But that really is kind of the most important thing, kind of with caution, and sometimes why people might be hesitant to prescribe it, because they don't, they get concerned that patients won't listen to the, because it works so well. But then, once you're using it, longer term basis, it's hard to know if you're still having the original illness, or now you're having kind of a rebound effect from kind of overusing that medication. And again, these come, Dristin is another brand that's over the counter. And a local pharmacist could help you kind of, get these. Some of them can be a little more expensive, more $15 for kind of the bottle. But again, it's partially because they actually work pretty well. The other medication that a lot of people consider when they're having like bad congestion is Sudafed. And Sudafed as active ingredient is pseudoephedrine. And this medication actually does work as well, but this is a more systemic version, and basically it'll kind of constrict kind of blood vessels, and it will reduce that swelling and congestion. It can work a little bit better if you're really kind of deep in your sinuses, because again, it's working on your whole body actually. But that's one of the side effects, and one of the things that I need to caution you about Sudafed is it causes that localized constriction of blood vessels everywhere that can raise your blood pressure, can increase your heart rate, and really can put you at risk, especially if you have underlying heart disease, high blood pressure, and something that really you need to get a doctor's clearance if you have any of those kind of conditions before using. I won't prescribe it or tell anyone to take it if they have a history of high blood pressure. Sometimes it can still be safe to use in a short term if your blood pressure is controlled with your medications, but as a blanket statement, because it can be an issue, I typically tell people to avoid it. But it's unfortunate because it does work pretty well. There are other types of medications that are very similar to pseudoephedrine or Sudafed that have an active ingredient of phenylephrine rather than the pseudoephedrine. That's like Dayquil that has like sinus in it. And those medications actually don't work as well. And it's just kind of important to kind of be aware. I like to break up the medications into the active ingredients, and it's the pseudoephedrine that is what is actually helping for congestion here. The thing that goes along with kind of these colds is also just the cough itself. And I think that's probably even more commonly kind of what, people initially deal with the 3 days of the, congestion, and then they come in that they have this really bad cough. And there's all different types of cough. But a lot of times it's basically, it starts as an upper respiratory, and then you start getting some drainage that kind of gets into the lung, and you get some mucus production. Sometimes with that drainage, all it does is it's almost like tickling the lung lining and causes this reflex to cough. And that can be really bothersome kind of for patients. And some of the medications, basically work to just decrease that reflex, that kind of feeling that you need to cough, and gives you some relief. But almost all those medications aren't treating any of the underlying kind of condition. So something like dextromethorphan, which is Robitussin. And basically this reduces your body's urge to cough, and it works kind of in the cough receptor of the brain. And it does work, and it will kind of reduce that. But again, it's not, treating any underlying, part of the condition. And it's just important to kind of be aware of that. The other thing is this is another dirty medication. I kind of view this almost as like a Benadryl equivalent. In short courses and doses, it does work, but it interacts with a lot of other drugs, specifically antidepressants, other pain medications like opioids, tramadol, and you can't drink alcohol while you're on this. And it's definitely you need to take it in the correct dosing. Taking increased doses will only lead to the side effects, which can be nausea, upset stomach, dizziness, and then rarely, but the thing that I worry about is a thing called serotonin syndrome, and that's basically a condition that can cause seizures and different things if basically taken with other medications that work similarly. And again, very rare, but just need to be aware if you are on a lot of prescription medications to be careful. A different medication that works a little bit better for treating the underlying illness is Mucinex, which is guanafenicin. And this helps thin and loosen the mucus in the airways to make it easier to cough up. So it's not getting rid of the cold, but basically it's allowing kind of things to thin and drain so that you can actually cough them up so that they can stop irritating your actual lining of your lungs itself. Some of the issues, they can cause some nausea and dizziness, but it can work for chest congestion, sinus congestion, and even kind of it develops into like a bronchitis. And again, the idea here is that it's thinning that mucus so that you can cough it up and get it out of your system. And then actually one of the best things that you can do is actually using honey or throat lozenges. So honey actually has some anti-inflammatory properties, and actually in a lot of studies works even better at cough suppression. You basically put a spoonful on the back of your kind of tongue and just kind of swallow, and can help kind of decrease triggering coughing fits. Again, it's not a perfect medication. Really, none of the cough medications are perfect. And I think that's one thing that's really frustrating. If someone comes up with a cough medication that worked as well as some of our other maybe nausea medications or diarrhea medications, to truly always get rid of the cough, there'd be a very wealthy, person. But a lot of it is just your body's kind of response, and it's trying to get rid of all that stuff. And so that's why I think Mucinex helps to try to help your body clear it, and kind of using the nasal sprays will help you prevent getting there in kind of the first place. It's not abnormal to have what's called a post-viral cough, meaning you initially had a virus, you felt, maybe, crappy for a couple of days, and then actually got better. And now you're not having any of the symptoms that you were having, but you just keep having this cough. And basically, the lung lining in the bronchioles can get just a little bit irritated during that, and it needs to heal itself. And there's nothing you can really kind of do, and you just will have this kind of cough, and sometimes it can last a couple of weeks. It can be very bothersome. We see it a lot with COVID specifically. It'll be like a post-COVID cough. And again, it doesn't mean that you're still contagious or sick, but it's just your body is kind of healing, and mostly in the lungs, that's causing, some irritation. And it basically, your body's response to that is to cough. Yeah, I think we talked a little bit just about Dayquil. It's always important with these combination medications to actually know what is in it. So Dayquil itself, again, there's lots of different forms that have very slight variations, but the regular old Dayquil has Tylenol in it, or acetaminophen, has dextromethorphan, which is basically that medication that works on cough suppression, and then medication phenylephrine, that is basically kind of a poor man's Sudafed. It works similar to basically constrict things, but there's actually some studies recently showing that it doesn't work as well. And then NyQuil is basically Dayquil plus an antihistamine that they're just using for kind of a sleep aid. The medication is doxylamine. So it really doesn't give you much more other than kind of a little bit of a sleep aid. In general, I like to kind of break things up into kind of what symptom is actually, bothering you and what you need treated, because a lot of people will be kind of using one or the other, that they might not need all of these active ingredients. If you're not having, a bad cough and need dextromethorphan, you should not be taking Dayquil and exposing yourself to that medication when that's not even the underlying issue. You can kind of break it up and take, if it's congestion, use the nasal sprays or use the Sudafed. Doesn't mean that there aren't good combination medications, and there's a lot of them over the counter. But it's kind of really important, consulting with the pharmacist and really reading the insert and make it, really small. You can see here what the active ingredients are. It's tricky, and I feel it's a tough, kind of issue for patients to deal with. Because obviously it's easier to just take one medication, but you want to take a medication that actually has the right ingredients that you're looking for. So hopefully, learning about some of these will be kind of, helpful. And I think that's, kind of most of the kind of medications. I think one of the things I just wanted to emphasize is just, as we get older, where our bodies are more sensitive to kind of drugs. Maybe you've been taking, dextromethorphan your whole life. Every time you get a cold and it's no issues, always has worked for you. Well, you might be more sensitive to it kind of as get older. You might need a lower dose, and you might not be able to tolerate it kind of at all. A lot of the side effects can also be kind of more pronounced kind of as we get older. And it's just a really important thing to know. I think a lot of patients, want medications to treat kind of their ailments, but sometimes, over treating kind of pain and other kind of issues can lead to more problems. And I think that's a lot more common kind of in the elderly population. A lot of things can cause sedation effects, Benadryl being a really, kind of good example, even loperamide. And sometimes just combination of medications, everyone will have a little bit of different kind of effect from, and that can put you at risk of falling, can put you at risk of getting dehydrated. And it's really important just kind of to be mindful. Anyone who is on, more than a couple of prescription medications, basically, definitely always talk to your doctor about kind of what medications you can add kind of to that regimen to treat, because the more kind of medications you have, the more interactions and the more likelihood for some side effects. And the last thing, basically, if you're having kind of cold-like symptoms, basically the things you can do to protect yourself is make sure that you're vaccinated for COVID, make sure that you're vaccinated for the flu. And actually, there's a new RSV vaccine that is out. RSV is kind of a respiratory, virus a lot of times that affects young children, but also the elderly population can be kind of more vulnerable, and definitely recommend talking to your doctor or trying to get that. But the biggest things that you need to seek care for if you're getting really short of breath, you get a persistent, fever, despite taking some of those, medications we talked about at the beginning for fever control. You're too weak to kind of walk around, kind of do your normal activities, cooking, getting dressed. Those are, signs that, maybe this is more serious and you need to kind of be evaluated, because again, a lot of these, will be tolerated, well, but there can be a lot of kind of, side effects, especially depending on your comorbidities.
I want to thank you, Joshua, for being on this program. I'd love to have you back again to talk about another topic.
No, thank you for having me.
So until next time, everybody, thank you. Bye-bye.